Before we start, we would like to remind everyone that this webinar is for awareness and educational purposes only. This does not in any way replace the assessment and evaluation obtained from a one-on-one consultation with a duly licensed physician. Good afternoon, everyone. Welcome back to another informative Biobalance webinar. Today, our doctor speaker will shed light on a complementary service that is gaining popularity, more commonly known and used for its aesthetic benefits. This service has multiple health advantages as well. Our speaker will talk about the different nutrients used in IV therapy, the benefits and risks involved in this service, and important pointers to consider before receiving any infusions. Our speaker today has 17 years of experience in practicing the arts and the sciences of medicine. She is constantly seeking ways to enrich her profession through continuous learning and patient empowerment. She is a board-certified specialist in internal medicine and an IFM certified functional medicine practitioner. She has active clinical practices in the Medical City, Biobalance, and Life Science Center. Dear viewers, it is our honor to have with us Dr. Den Lavillas.
Hello, everyone. Thank you for the introduction, Mark. Is it clear? Is my audio clear? Okay naman?
Yes, Doc.
All right. Okay. Sige. So, let's begin this webinar na. Okay. Before we begin, first, I would like to say this. Okay, I'll just flash this on screen. No, we are what we eat. Does everyone agree? We are what we eat? Okay. So, we all know that that nutrition is very vital. No? It's very critical to our health. And really, as a healthcare practitioner, part of my challenge, both for myself and for my patients, is how to optimize our nutrition, no, our nutritional intake, not just through the food choices, no, not just through the food that we eat, but also through the way that these foods are absorbed and metabolized into the nutrients that our body needs. No? So the saying, you are what you eat, I think is not really complete. We are not just what we eat, we are also what we digest and absorb. And we may be eating the best food or sourcing specific foods for their nutritional values, but also wasting a lot of time and money and effort because your digestive system isn't adequate enough or efficient enough in delivering these nutrients from the foods to your bloodstream and organs and tissues efficiently. No? So in this day and age, we have actually advanced our healthcare and technology to such an extent that we now have access to many ways by which we can improve ourselves, our health, our well-being. And among these modalities are IV nutrient therapies, which we are going to be talking about in this webinar to help you make more informed decisions regarding this kind of approach. Okay, so in this webinar, we will be talking about some common nutrients that are used in IV therapy, IV nutrient therapy, the benefits and risks of IV nutrient therapy, and some usual indications for its use and what to consider before receiving IV nutrient infusions. So the emphasis of this webinar will be on the ability to support non-life-threatening conditions or non-urgent concerns. Okay, and it should not be confused with other types of IV treatments like chelation therapy, for instance. No? So this is really talking about just straightforward infusion of IV infusion of nutrients, no? Direct injections of nutrients. Okay, so what is IV nutrient therapy? Okay, it is really a direct way of administering your vitamins, minerals, other nutritive substances into the bloodstream. It is really an elective, adjunctive, and supportive procedure. So we do not consider this an alternative solution for any specific medical condition or diagnosis. No? So IV nutrient therapy, that's been going on for many, many years now. And typically, in the standard conventional setup, IV therapy is really a method that we use in the hospitals, for instance, or in the clinics, in order to hydrate patients and provide them with important nutrients, such as when patients are not able to eat solid food because they're being prepped for surgery, or when they're recovering from surgery, or if a patient is having difficulty eating by mouth or having difficulty keeping the food down because they keep vomiting, or if patients are having problems with food absorption because of irritable or inflamed bowels, or as a general supportive treatment when we have infections, for instance. So in the hospital, more often than not, we do give IV fluids, we give IV treatments to help our patients recover faster. So this is standard of care. Okay. However, even before the pandemic, there has been like a growing awareness of the importance of nutrition, not just for disease prevention, but also for health maintenance and optimization. And given that patients are more health conscious, health curious, and health aware now, it's also a common question that we ask: how else, doc, can we facilitate a faster way of correcting my nutritional imbalances? Okay, so yeah, so IV nutrient therapy, as I mentioned earlier, it's really a direct way of delivering nutrients into the bloodstream through direct injection. So that means using a syringe, or through a process of infusion. So that's why you hear of drips, IV nutrient drips, via sterile solutions of vitamins or minerals and other nutritive substances. So it's currently regarded as one of the fastest ways of administering vitamins and minerals, because it involves a direct infusion into the bloodstream and it bypasses your digestive system. But because the procedure is invasive to a degree, it's very important that the procedure is done only by medical professionals who are experienced in doing IV procedures and who take to heart aseptic safety techniques to minimize risks, and are also trained to address any possible urgent or emergent issues that may arise from the IV procedure. So here are traditional uses for IV nutrient therapy, like for people who have burns or fluid losses from surgical or traumatic wounds, or losses due to gastrointestinal disease. So those are just typical indications. But the interest in IV micronutrient therapy has gone beyond the hospital setting. Although these IV treatments, they aren't exactly new. They've traditionally been used in hospitals, to help patients rehydrate, to also restore nutritional deficiencies. And IV fluids in their most basic form are usually combinations of salt water electrolytes, salt water plus sugar, like that. These types of fluids are really used to maintain the body's homeostasis, or the body's balance. So when the patient may be dehydrated from vomiting, for example, or when they're not allowed to eat due to a medical condition, or in preparation of an upcoming procedure or surgery, for instance. So maintaining the body's homeostasis during these circumstances is very important, because without the proper balance of fluids and electrolytes in the body, the fluid can leak out of your vasculature, it can leak out of your bloodstream into places where they're not supposed to be. So tissues can have pressure in them that shouldn't have, and then the bloodstream will have less fluid to circulate oxygen in. So those things need to be considered. Among complementary and alternative medical practitioners, IV nutrient therapy is also a popular approach. And the interest in the use of this kind of modality has been growing, as evidenced also by the number of facilities, both local and abroad, that offer these kinds of treatments, no, as a main service. No? So there was even like an online survey that was conducted before by Burkhardt back in 1991 from over 12,000 patient encounters. And the data there suggests that IV nutrient therapy is widely used for a variety of conditions, most often related to fibromyalgia and chronic fatigue syndromes, with positive results. But despite its popularity, there are really not enough controlled trials for IV nutrient therapy. Okay. There was one that I encountered that was done in Yale University back in 2009 for fibromyalgia, suggesting therapeutic efficacy, although the sampling size was still quite small. And there was also a pilot study that was done by Massey back in 2007. And all participants, although they were little lang 7 participants received IV nutrient therapy for a week, once a week for about 8 weeks. And all the participants who had long-standing fibromyalgia symptoms, at least 8 years, had already tried conventional therapies such as antidepressants and pain relievers, non-steroidal anti-inflammatory drugs, exercise, without really significant or lasting relief. But all had improvement in their symptoms and quality of daily living, quality of activities of daily living when they underwent IV nutrient therapies. So, but the when it comes to the typical like evidence-based studies, we don't have so much data about IV nutrient therapies yet. I suppose also because we are all biochemically unique and individual, so it's kind of difficult to really come up with uniform studies, for these kinds of modalities. Okay. Okay. So there are also other. One of the ways by which IV nutrient therapy is said to directly help is because of the changes that they affect in our ATP-ADP ratios. So the ATP-ADP ratio, that's a critical parameter of cellular energy status, and it drives many metabolic activities and reactions in the body, including glucose metabolism or the Krebs cycle, or even the way that cells talk to each other. Okay, so I put here some references that detail that more. Okay, and these are also other indicators of micronutrient deficiency. So for instance, if a person might have poor wound healing or muscle weakness, or if there are poor immune responses, like if you're susceptible to frequent infections. Of course, if you have particular lab values that really indicate nutrient deficiency, like if you have iron deficiency anemia, for instance, or low vitamin D, or if you have pre-existing lifestyle habits that may already predispose you to malnutrition, like excess chronic alcohol intake, or substance abuse, or skipping meals, things like that, or your food choices aren't replete in fruits and vegetables, like that. So, or if you are also someone who has been taking medications for a long time, there are certain medicines that also have direct nutrient inhibitory effects. Okay, like for instance, people who have been taking statins for a long time would usually also have low ubiquinol CoQ10 levels in the body, because the mechanism of action of the statins is it drives along that same pathway for energy production. So, or if you have body composition changes, like you have low muscle mass, or if you have an increased visceral fat value, physical changes, so like these, for instance. So these are pictures of corkscrew hair, and you see gum inflammation or gingivitis, no? So those can be related to vitamin C deficiencies. Or if you see this, no, like if your teeth are nauupod na, no, that means your teeth are, that's tooth attrition, no? So, or if you have these stress lines on your nails, now usually they appear during periods of stress, or if you might be exposed to, say, heavy metal toxicity and a greater need for detox, or if you have an enlarged tongue with scalloping like this. No, so those can be related to B vitamin deficiencies. The tooth attrition might be related to a vitamin D issue. Or if you have like symptoms like burning tongue, for instance, mahapdi, no? Pwedeng related sa vitamin C deficiency yun, or deficiency or imbalances in your B vitamins. Okay. And then this is another common finding. No? If you have rough skin on your arms, on the backs of your arms, no, sometimes that can be related to deficiencies in your essential fatty acids, or you might have low antioxidant levels. So your antioxidants are your vitamin A, your C, your zinc, like that. You can have B vitamin deficiencies. Or if you have bleeding of the nails, no, that can also be related to a B vitamin deficiency. Okay. So, yan. So, why IV nutrient therapy? Basically, it's a modality that can assist in increasing the availability or the bioavailability of particular nutrients. And it can help to temporarily boost metabolic activity at the cellular level, so that energy is manufactured by the cells at a higher, more efficient rate. So, yeah. So, it supplies nutrients to our cells without so much gastrointestinal interference, and that way it can assist in correcting or repleting nutrient deficient states and dehydration states faster. So if the patients have difficulty digesting food, or have altered stomach acidity, or they have what we call leaky gut syndrome, no, that's basically a problem with digesting and absorbing your nutrients properly, or they simply cannot absorb or receive the full benefit of the food, or even from taking oral supplements, vitamin nutrient supplements, they may respond better or well to an additional IV nutritional regimen also. Okay. So, so IV nutrient therapy is really an additional means of supporting the body's biochemistry and physiology through the provision of these nutrients. Also recognizing that when some nutrients are taken orally, many of these might be metabolized only up to a particular degree. So only a fraction of that oral dose that you might be taking might end up getting used by the body. So we can use both a combination of IV and other special forms or oral formulas of nutrients for a more personalized care plan for each person. So what it does is really it circumvents the possible GI upsets or the loss of potency from just taking oral supplements. Okay, so yeah. And then, so here, so so some of the common nutrients that we can actually provide through IV nutrition would include vitamin C, which is really essential throughout the body. It maintains both our musculoskeletal and our circulatory systems. It provides immune support. It can help in pain reduction. And note that vitamin C isn't really produced by our bodies naturally. So we must be able to consume it through diet, mostly. And our bodies can't really absorb high amounts of vitamin C without causing gastrointestinal distress or diarrhea. It's acidic. And so IV vitamin C can allow for higher doses to be tolerated in people who really need it. Okay. And vitamin C is important because it works together with other enzymes in the body to make or produce collagen, which is a main ingredient in all our connective tissues. Okay, so when you take intravenous vitamin C, it can reach much higher levels in the blood uh, rather than when it's taken just by mouth. Okay, and there are also studies that suggest that higher levels of vitamin C may cause the death of cancer cells. So in the laboratory, high dose vitamin C has been studied as treatment for patients with cancer ever since the 1970s. And they put the reference here below if you're interested in those. Although in the clinic in Biobalance now, we won't really be catering so much to people who are sick. So it's really better that you also see your attending specialist to see if these kinds of treatments are appropriate for you. Okay. Yeah. And then vitamin D is another common nutrient that we can administer. This one we usually give intramuscularly. So vitamin D is important for strong bones and teeth. It can help us absorb and metabolize our calcium better. It can affect cell growth and differentiation. So it also has immunoregulatory effects. It can help enhance mood. And really outside, there have been a lot of studies already correlating vitamin D with lower cardiovascular events or risk. There have been double-blind trials for vitamin D and psoriasis, for mood enhancement, etc., etc. Okay, and then glutathione is also very popular as a master antioxidant. It's actually found in virtually all living cells. But our glutathione levels decrease as we grow older or as we age. Okay, so this is an extremely important molecule because it acts as one of the main intracellular protectors of our cells against oxidative stress or aging or rusting of the cells. And so it helps to prevent damage of important cell elements by what it does is it accepts reactive protons from free radicals, and so that neutralizes their ability to cause cell damage. And it can also act as a secondary antioxidant. It helps to recycle other antioxidants, like it helps to recycle our vitamin C, our E, and it can also help to it supports DNA functions. It's a primary protectant of the skin. That's why it's popular even in aesthetic facilities. It protects our lenses, our corneas, our retinas against radiation damage. It helps in our detox pathways in the liver, the kidneys, the lungs, the intestines, the skins. So it also helps us to get rid of everyday toxin exposures from chemicals or radiation, potential carcinogens from the environment or from pollution. So the majority of chronic neurodegenerative conditions, like Parkinson's, have also, or multiple sclerosis, those have all been linked to low glutathione levels. But glutathione, it's easily depleted by poor nutrition or excess alcohol consumption or stress, certain genetic profiles like that. Now, the question is, why can't we just take glutathione orally? Because glutathione has very poor absorption and it's quickly broken down by enzymes when you take it by mouth. So IV delivery is actually more superior for receiving glutathione that can be used by the cells. Okay, so okay. Your B vitamins naman. So we all know that your B vitamins are important for nerves, for neurotransmitter formation, for memory, concentration, mood. It helps to convert our food to energy. Practically all the steps in the Krebs cycle are dependent on your B vitamins. It has benefits in your cardiovascular health and many other cellular processes. Okay, and then magnesium. Again, this is one of the most abundant minerals in the body, and it's responsible for hundreds of cellular functions. But I think some of the more important functions are that it helps to improve your insulin sensitivity. So if you have a tendency to have slower sugar metabolism, or if you're starting to notice that your sugars are already creeping up, if you have a family history of diabetes, making sure that you have adequate amounts of magnesium will help. Magnesium also supports your sleep. It helps to regulate heart rhythm. It helps to promote bowel movement regularity. So if you have a tendency to be constipated, magnesium can help. Magnesium is also important for smooth muscle relaxation. So it's important, it can help support management of your blood pressure, if you're prone to migraine headaches or cramps, muscle spasms, dysmenorrhea, for instance. So those are the some of the applications of magnesium. And then it can also help to promote better DNA synthesis. Okay? Yeah. Okay. So CoQ10 is another common nutrient, IV nutrient. No, CoQ10 is really a cofactor in that process by which your cells produce energy. So it plays a role in all the energy dependent processes of the body. And basically, it's the brain, the muscle, the liver, and the heart that have the most need for energy, for mitochondrial support. Okay, so if you have low levels of CoQ10, what the patient will usually manifest are symptoms related to brain drain pain syndromes. So brain fog, weakness or low energy, problems with the detox, heart irregularities, and things like that. Okay, and then another nutrient that we can also provide through IV infusions is carnitine. So carnitine can help to facilitate the transport of fatty acids across your mitochondrial membrane. So the mitochondria are really the batteries that make your cells function properly, that drive your cells to produce energy. So it can help support your fat burning ability. It can help to lessen brain fog. It can help harness more energy. That's why it's also popular among athletes, and fitness buffs. Carnitine. It helps with recovery. Okay, so yeah, and then so basically all these, they help to have benefits in terms of mood and energy and athletic performance, your immune functions, and sleep and recovery. Even pain threshold can also improve. So yeah. Okay. So usually, if you're thinking of you're considering going for an IV nutrient treatment, do kindly expect that we need to gather as much data on your medical history and your health concerns as much as possible. And that will also include reviewing previous labs that you might have had in the past, doing a physical exam or a nutrition assessment. So for me, it's very important that I get a better idea of what your comorbids are, what your current health concerns are, whether you're taking any medications or if you've gone through any previous treatments, what supplements you might also be taking, any previous response to IV therapies. So usually if you have anxiety, or was there any history of difficult insertions or difficult IV access, those are also things that we need to consider. Or if you've had previous allergic reactions. So those are important. And then given that this is well, it's not standard of care medicine. We do need to get your informed consent for the procedure. So it's not something that, we just foist on patients. No, it's really just an elective supportive kind of treatment or approach. Okay, and we also do need to monitor you throughout the procedure. Okay, so that's very important. Our IV nutrition, no, uses vitamins and minerals that have known nutritional benefits, and the way that they're formulated is really such that they just, it's very low potential for serious side effects at the doses utilized in the formulations. However, there's always the potential for unwanted side effects with any sort of invasive treatment. So all IV infusions, whether that's nutrient therapy or medication, IV medication, those would share potential risks for pain, for infection, for inflammation or phlebitis, at the injection site and things like that. So yeah, so that's just something to keep in mind. Okay. And of course, this is very useful for your care team. Now, if you've had previous labs, that would be very helpful in terms of personalizing your care plan. Okay, so, and that can also help us figure out what other adjunctive modalities might be appropriate for you, because you can't just keep, taking IV therapies, it has to, your treatment will really come from a more holistic perspective. So aside from the IV nutrient therapy, we might also need to discuss certain lifestyle modifications or maybe changes in your food planning, how else to improve your sleep or your exercise, how else to manage your stress, so things like that. Okay. G6PD screening, okay, this is important because there are certain people who have deficiencies, like a genetic mutation. Why did it stop? Recording stopped. Hello? Hello, Mark? We can continue.
Yes, Doc.
Where did I stop? Dun sa G6PD, no? G6PD screening.
Yes po.
No? Okay, sige. Okay, sige. Oh, okay. So I mentioned this only because if you have this particular genetic condition, so G6PD deficiency is really a genetic mutation that's more commonly found in people who are of African or Mediterranean descent. So if you have a deficiency in this enzyme called glucose 6-phosphate dehydrogenase, you can be more prone to red blood cell destruction or hemolysis, particularly with vitamin C. Okay, so this is really a contraindication to IV vitamin C therapies. Okay, but most patients who have this condition will also know that they have this because G6PD screening is now part of the standard newborn screening. And also, it runs in the family usually, and patients will also have a history of known hemolysis or RBC destruction, lalo na with certain food exposures like fava beans, for instance. Yeah. So anyway, so these are just some of the useful labs that we can consider, no? And for me, this is important. We have organic acid tests and nutrient panels that are also useful tools that can help us provide more insight into your metabolic and nutrient needs. And because of the possibility of electrolyte shifts and with certain conditions, we have to have appropriate baseline labs before you can even consider like IV nutrition. No? So the most important factors to consider are what is the status of your kidneys, what is the status of your heart, no, your cardiovascular health, what is the status of your immune system. So those are things that we need to consider. Okay, and these are just some examples of common lab indicators for specific nutrient needs. Like if, for instance, you have elevated liver function tests like GGT, then that would indicate greater need for glutathione and maybe even possibly magnesium augmentation. Or if you have elevations in your ALT, AST, no, those are common blood chemistries that could indicate imbalances in your B6, your magnesium levels. If you have elevated homocysteine levels, or if even in just the simple CBC, in your CBC, there's usually a part there that illustrates red blood cell indices. So if your mean cell volume is elevated, that could mean you might need more methylation support, or B6 or magnesium or other trace elements. Or if you have a low white blood cell count, that could be greater need for zinc or methyl support, magnesium, etc. So those are just examples. There's plenty. Okay, and we usually do that assessment not just from the labs but also from like a nutrition focused physical exam. And then, of course, there are some contraindications to IV nutrient therapy, like what I mentioned earlier. So G6PD, especially for vitamin C infusions. If you have known allergies to any components, although this is a bit, you don't really have allergies from vitamins and minerals. No? It's usually allergies maybe to the, say, preservatives or whatever. No? Or usually if you have had plenty of environmental toxicity, that can also predispose you to be more hypersensitive. So yan. Or if you have significant liver or kidney disease, heart conditions, uncontrolled blood pressure or asthma, or if you have asthma or COPD in exacerbation, bleeding problems, if you have documented low platelet counts, if you're pregnant and breastfeeding, if you have a history of unstable seizures, or if you're mentally confused, or certain medications might also be contraindicated, like those that can predispose a person to having electrolyte imbalances, for instance, like diuretics or antiarrhythmic agents, for instance. May special considerations yan. And yun nga, if you have IV insertion issues, like a history of difficult insertions, or if there's presence of local infection on the IV site, or if you have a swollen arm, for instance, we typically prefer to defer or hold off any IV nutrient therapy recommendations. Or if, for instance, if you're taking anticoagulants, that might pose an increased risk for bleeding during the IV insertion. So things like that we need to consider. And then one of the more common forms of magnesium is magnesium sulfate. So if you have an allergy to sulfites, and or if you notice, you have headaches, you can have headaches from those. So things to consider. Okay. And then other considerations, sometimes when people, these are really more as reported by patients. So when patients go through IV nutrition therapies, sometimes the coldness or the coolness of the solutions might cause some discomfort or a sensation of like cool, that they might find weird. Or you have to be also careful with the rate of administering the nutrients, because, for instance, rapid administration of magnesium can also lead to a drop in your blood pressure. It can cause dizziness or even palpitations. For some people, it can cause flushing or a sensation of warmth. Or some people, they say, parang I'm tasting the vitamins, doc, like that. Or it can be like a metallic taste. Or some people might feel nauseated a bit. Or you can have changes in the color of your urine with like your B vitamins, for instance. Patients will also report feeling lighter or having a brighter feeling, or sometimes even like sharper vision, which if they're not used to it, it might feel a bit scary or weird. No, but yeah. So to also help minimize the possibility of adverse reactions, no, we really choose to dilute most of the micronutrients in a larger volume of saline, so that the infusion solution itself remains isotonic, or that means near the same concentration of your blood. So that's less likely to produce any side effects. And we also do slow pushes. No, we don't do rapid pushes. And so it's also very important to stay hydrated, no, and to also eat before a few hours before the procedure. Okay, so usually when patients experience some of these changes, no, in sensation, it might feel a bit weird at first, and the onset can vary between patients. So sometimes it can be felt right away, or it can happen after several or a few hours later, and the effects can last from up to several days to a few weeks. It really depends. It depends. Okay. And then some of the complications of IV therapies in general, okay, would include easy bruising or hematomas on the IV site. If there's there of course bleeding when the needle punctures the skin, or like infiltration from the blood vessels. You can have irritated veins or inflammation of the veins, which we call phlebitis. You may have systemic infection because it is an invasive procedure. And then these are other complications. No? But these, well, in the outpatient, that's why it's important that when you go for your IV nutrient procedures, these are done under the guidance of trained medical people who know how to address these things properly. Okay. Okay. And then when it comes to frequency, okay, this is also a common question that we get asked. The intervals and the number of treatments always vary. It will always depend on your patient, your own goals for yourself, and also on reassessment. So if, for instance, it's easy, that's why sometimes it's also a lot easier to track whether you're improving if you have baseline labs. So we can check, oh, okay, my vitamin D is better now. So that's one goal down. Okay. So, or if there are improvements in the skin, for instance, it can be subjective or objective improvements. But on average, we do recommend IV nutrient intervals of minimum 2 to 4 weeks, with reassessments after 2 to 4 infusions. No, so in a true deficiency state, the patient can tolerate larger doses of a particular nutrient, but for instance, for cardioactive nutrients like magnesium, for instance, they should still be given at accepted safe doses regardless of the need. So we can't really just keep giving more and more, and frequency of the IV treatments are important. No, those are things to consider, because you can also have buildup of nutrients, for example, and that can also cause some harm to the patient. So yeah. There are some clinics that advocate, that use protocols that advocate as often as 3 times a week. But we're generally comfortable providing these kinds of IV nutrient therapies at minimum 2-week intervals. So once a month on average, if you like. But IV treatments are merely provided, at least by Biobalance, to support its other current services. And we prefer not to limit the treatment to just providing IV treatments. When we see our patients, it's really to also help, enable the patient to have a more holistic approach to their health. So it's always basics. We focus on nutrition, of course, your movement. We ask questions related to your sleep and your stress levels. So those are all very important. Okay. And then you also have to remember, so IV nutrients, it's really a way to help activate and support our innate healing mechanisms. But IV nutrient drips are also not meant to replace or be an alternative solution to conventional treatments for specific conditions. So this is really more of, we would like to adhere as much as possible to standard of care plus. Okay, so that's very important. And it's still important to make it your goal to eat a variety of fruits and vegetables, whole clean food, to optimize the nutrients you're getting on a daily basis. Okay, so that's important. And of course, like anything to do with your health, the best place to start is really to have a good discussion with your healthcare provider first, who knows your medical history and who can recommend whether IV vitamin nutrient therapy is safe and appropriate for you. Okay, so with that, I turn you over again to Mark. Yeah, so there. I hope this helped to answer some of your questions about this kind of treatment.
Thank you for that very informative session, Dr. Den. There are many points in your lecture that are truly an eye-opener, especially when it comes to making sure that IV infusions are safe. And for that, Doctor, we have several questions from our viewers. Let's start with this one. As a generally healthy person, how often do I need to have an IV therapy?
How often?
Yes,
Sorry,
Doc.
how often? Oh,
Yes.
it really depends. That's why usually when for patients who are new to this kind of modality, it's really better that we have a health assessment first, like a one-on-one discussion first. And so at the clinic, we usually ask our patients to fill up a questionnaire. So it's a bit comprehensive, to give us a better insight into their current health concerns, their symptoms, even if you may not be diagnosed with any particular disease. Sometimes the symptoms can also be telling about what sort of nutrient needs you might have. And then, of course, now we have virtual telemed consults, but we on site we can also do physical examinations. We can check your body composition to also see, and then depending on that, then we can come up with like a plan for you. So, and usually because IV nutrient therapies are not treatments that you can really avail of day to day, diba? So ideally, that's supplemented also with other modalities. So yeah, so that's where your lifestyle will come in. That's where maybe some other bridging supplements might come in, depending on your nutrient profile or your health profile. So yeah,
I see.
it really depends. But on average nga, what I from our own patient pool, diba? We on average mga 2 to 4 week intervals. Once every 1 to 3 months. It really depends eh. I can't say na specifically. It depends.
Also depends on the goals of the patient.
Yes,
Right?
it depends on the goals of the patient. So like for instance, we have patients who will become interested in it only because of like a particular events. Like for instance, doc, I'm preparing for a wedding, and I want to be energetic and they want to glow, yung mga ganyan. Or sometimes it's because they need to travel and they feel like they need that extra boost of for protection of their immune system. So sometimes it's things like that. So it can be it really depends on the patient's goals. Hello, Mark. Mark. Hello?
Hello, Doc? Hello, Doc?
Ayan.
Okay na, Doc. Sorry.
Oo.
May
Nag-freeze.
connection, Doc.
Oo. Oo nga eh.
Let's proceed to the second question, Doc. But it's
Okay.
a short question po. How long do IV drips last?
Oh, okay. It also depends on the kind of formulation. So drips can last as short as 30 minutes to maybe about 2 hours, depending on the mix and the combination of nutrients that we recommend. Yeah.
Next one is, you mentioned G6PD earlier po. There's someone who asked lang po kung what are the types of G6PD screening?
Oh, in the hospitals, usually that's part of newborn screening already. So when the baby is born, 'di ba, they usually, well, there's a consent form for it. Then they ask parents if they want to go through newborn screening. So, yeah, but you can also check for G6PD issues through a blood test. Pwede naman din. But usually, you will know na if you're an adult already, you usually know already if you have G6PD, if you have particular reactions, say, to fava beans, or if you have a history of hemolysis, no? Yung ganun. Laman mo yun, or if yung sa family history, uso siya. Kasi it's really a genetic condition. Yeah.
Okay.
Do we have many people in the audience who are new to IV therapy, or who have done it na before, or that's curious ako doon. It's interesting to know.
Wala pa, Doc, eh. Parang they're
Uh,
just asking. They are interested on how does this IV therapy works, eh.
yeah. 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 Unfortunately, kasi there's not really a lot of like standard evidence-based trials regarding IV nutrient therapy. Although, even in the hospital, it's something that we do give our patients. So like when patients are admitted because of, say, diarrhea or malnutrition, or substance abuse, usually giving IV nutrients is part of the treatment plan. So yun, it's just that this is a bit different because it's like outside the hospital already, but I feel it's also a responsibility to really inform you, because there are some facilities out there who may not have the same safety or quality standards, and it might also do more harm than good. So yeah, it's important that when you consider these things, you have that informed consent, and that you talk to your doctor about these things. Yeah.
Yes. I think this is the last question, Doc.
Okay. All right.
We have ito po. Can you recommend a specific IV tip for someone who had COVID before?
Oh, okay. It depends also, eh. Well, the most basic one that I would recommend would be an immune boosting drip. So that's really, vitamin C with a shot of vitamin D and maybe glutathione. But we also have patients who have gone through COVID who may also have other underlying issues, and or if they manifest in particular with long hauler symptoms, they might benefit more from even B vitamins. And it depends on their current profile, no? If they still have residual symptoms, etc. Depends. Yeah.
May pahabol pa, Doc. Sorry.
Mm,
This lesson na talaga.
no
I
problem.
have a lot of food allergies such as mangoes, eggplant, and shrimp. Can I still avail the IV nutrition therapy?
Such as, sorry,
Mangoes, eggplant, and shrimp po.
mangoes, eggplant, and shrimp.
Yes
Oh,
po.
okay. Yeah, yes. Pwede naman, no. And usually when we do recommend those, no, if you don't have what you call this, actually I think it's really mostly egg and dairy products. If you have like very prominent hypersensitivity reactions to that, I would also proceed with caution when it comes to glutathione. Yeah, but you can try like the basic drips first. So vitamin D usually we find is commonly low in people who have a lot of hypersensitivity reactions. So you can start with that first if you like. And then usually if you don't really have allergies with oral, say vitamin C supplements, no, then likely okay naman din. Oo. So yeah.
For now, I think that's all po. If you don't have any more question, I'd like to thank everyone for joining our session today. Dr. Dan, again, thank you very much for your time and for the learnings that we had for uh, for this webinar po.
All
And
right. I hope this helped because, you know, because medicine is really evolving and it keeps changing, lalo na now with the pandemic, diba? So
mhm.
even us healthcare practitioners, we're also continuously learning and trying to find ways to, help our patients. So yeah, if you have like the time, you come and we can have like a more thorough discussion about this, in the clinic if you're interested. Yeah. Mhm.
So for those who want to know about IV nutrient drips and what cocktail drip suits you, message us to set an appointment with Dr. Dan Lavillas or any of our in-house MDs. Remember, safety is the key, especially when receiving treatments like IV infusions.
Mhm.
You may also visit our website at www.biobalanceinstitute.com to learn about our current IV drips and other products and services. Also, don't forget to like and follow us on our Facebook and Instagram page. As always, thank you everyone for tuning in, and we look forward to seeing you in our next webinar. Thank you po, Doc. Thank you,
Thank
everyone.
you. Thank you, everyone.